Do you often worry when a baby seems very weak, struggles to feed, or has unusual physical features? Let's talk about a rare but serious condition called Edwards syndrome. Have you ever heard of a baby being born with a heart that doesn't beat quite right, or a tiny one who cries very little? These can be signs of Edwards syndrome, also known as trisomy 18. It happens when a baby has an extra copy of chromosome 18, which causes many body parts to develop improperly. It's not something parents could have prevented, it just happens by chance during early development. So, what causes this extra chromosome? Think of it like a mistake when copying a book. Every cell in our body has 46 chapters, or chromosomes, 23 from mom and 23 from dad. But in Edwards syndrome, one cell from mom or dad brings 2 copies of chromosome 18 instead of 1. So instead of 46 chromosomes, the baby ends up with 47. It's not inherited like eye color or hair. It's just a random mix-up when the egg or sperm forms. Imagine trying to bake a cake and accidentally adding 3 teaspoons of salt instead of 1. Everything turns out very different. That's what happens here, and it affects how the baby grows even before birth. Imagine holding a newborn who is very small, seems very stiff, or has tiny hands that are clenched tightly with fingers overlapping. These are common signs of Edwards syndrome. Babies might have a small head, low set ears, a small jaw, and heart defects, which can make their breathing weak or irregular. They often have trouble sucking or swallowing, so feeding becomes a big challenge. Some parents notice their baby doesn't move much or cry rarely. Many have kidney problems or severe developmental delays. Sadly, most babies with this condition do not survive more than a few weeks or months. But every baby is unique. Some live longer with special care and love. How do doctors find out if a baby has Edwards syndrome? Think of it like a detective using clues. During pregnancy, an ultrasound might show a baby is growing slowly, has a heart defect, or abnormal hand positions. A blood test from mom, called a screening test, can hint at a problem, but it's not 100% sure. Then, doctors can take a small sample from the placenta, CVS, or amniotic fluid, amniocentesis, to check the baby's chromosomes. That's the real proof. After birth, a blood test confirms it. There's no cure, but treatment focuses on comfort. For example, a feeding tube might help if the baby can't suck well. Heart surgery may help some, but decisions are made with families, knowing the challenges. Care is about love, comfort, and doing what's best for the baby. Can Edwards syndrome be prevented? That's a hard question. Since it's caused by a random change in chromosomes, it's not something parents cause or can avoid through diet or lifestyle. It's like rolling dice. The odds are very low, but sometimes it happens. Older mothers have a slightly higher chance, but it can happen to anyone. The best thing, if you're planning a pregnancy or are pregnant, talk to your doctor about screening tests. These tests won't stop trisomy 18, but they can help you prepare. Knowing early helps families make gentle, informed choices with kindness and support. There's no miracle cure yet, but science is moving forward. Researchers are studying how the extra chromosome affects each organ, so they can help babies live more comfortably. Some hospitals now offer palliative care teams, special doctors and nurses who focus on comfort, not just survival. They help babies feel warm, calm, and loved. New tech in genetics also helps parents understand the chances in future pregnancies. And some labs are exploring gene editing in animals, still very early, but one day it might help prevent chromosome issues. The biggest advance, helping families feel heard, supported, and never alone.